Hi, I'm Sarah. I'm going to be recording my Cranium Trigger. And so I wanted to start by showing you my console setup here. I've got my fake patient in here. You can select different exams by tapping the touch screen. We have it off of AEC here, so we can adjust. Probably using around 85 for most of my exams. It's going to change depending on our exam. We also have it set to the wall here. And so as far as consoles, we are ready to go. Now we've got this way, and just to show you my tube setup. So you do want to have a horizontal beam to start. Well, actually, we'll be putting a 15-degree angle on, but we'll wait for that part. I want to track. So now I'm going to detent to 40 inches. 40 inches, yep. And we are using a DR system. So I'll be needing to change my plate in and out automatically. I'm going to good to go. And for most of these, we'll just be using about a 10 by 12. So there we go. We're all set up. I've got my blood apron nearby. I'm going to be having my patient seated for all of these. So I've got my stool. This has been cleaned off and is ready to go. It's important to do that for every patient, especially when their face is going to be right up against it. Okay, so we're all set up and I'm ready to get my patient. Hi, come on in. I'm Sarah. I'm at the radiology department. I'm going to be taking your x-rays today. Can you tell me your full name and your date of birth?
Sky Straub, and my birthday is May 9th, 1987.
Okay, perfect. Is there any chance you'd be pregnant at all today?
No.
Okay. And have you removed all of your hairpins and jewelry that could be around your head or in your mouth? Okay, good. What happened? Why are you having x-rays taken today?
Well, my 2-year-old, he's a lot stronger than he looks, and I got whacked in the head with a stick, and it mostly only hurts right here, kind of in the front. And my doctor's worried that, there's something wrong. There's like a lot of swelling here. And I feel like I have a headache forever.
Okay. So, and this is on the right side of your head. Did it happen recently or?
Yeah, like yesterday morning.
Okay. And there hasn't been any other trauma to your head at all?
No.
Okay. So what I want you to go ahead and do is take a seat here. I'm going to have you facing my board. We're going to start with the PA axial projections, the Caldwell method. It involves a 15-degree angle of the tube. So I'm going to go ahead and put that on now. We're going to 75 degrees. For this projection, it will be exiting the nasion. I want you, Sky, to scoot up nice and close. You're going to put your forehead and your nose on the board. It's important to make sure that this is nice and clean for every single patient. It's really important. And I'm going to roll my shield behind you here. And I'm going to give you this one. We'll just put it on your lap just so I don't forget. And I'm going to be putting my left marker on the board. Okay, so you just put your forehead and your nose there. Tilted. Good. Got you nice and centered there. I do see that I have her occipital meatal line nice and perpendicular to the board here. And perfect. Oh, I'm going to put my marker on the board. I'm going to put it on backwards for stab points there. Here we go. And I'm going to make sure I'm going to put my collimation here too. Yeah. Okay, perfect. So I've got my tube angle 15 degrees on. You can increase it for if you're looking for other structures like the superior orbital fissures, or if you're looking at the rotundum foramina. But for this, since it's just a general school lecture, we're going to keep it at the 15 degrees. And I'll be using a technique of 85 at about 3 knots. So, Sky, I want you to hold your breath, expose. Okay, so that is the
the axial projection. Now I'm going to be doing my lateral. So this is as simple as just having your patient rotate their shoulder in towards the board and looking at you. There we go. Still have the right side of my patient on, so I don't need to change out my marker. And I'm going to have my beam horizontal again, entering 2 inches superior to the external acoustic meatus, about there. So my board is going to move. I'm going up a little ways here, elevating down. Okay. I am propping up a little bit of her chin down here, so even though that's about 2 inches, I'm going to come down just a bit. Oh, I got all of her things there. Let's see, her mid-sagittal plane is now parallel to the IR. She did say she got hit on the right side of her face, so this is a good position for her to be in a right lateral. For this one, I'll be using a technique of about 85 at about 3 mass. So, Sky, I want you to hold your breath, expose. All right, for this one, we'll be doing the AP axial projection, also known as the Towns method. So, Sky, I'm going to have you turn around and face my tube again. Her right side is still on. Okay, so now that I have Sky facing in an AP, I'm going to change my tube to 30 degrees cotton. So down to 60 degrees. Almost there. There. Okay. This is going to be entering about 2.5 inches superior to her glabella, passing at the level of her external acoustic meatus. I'm going to turn the light on, okay? Up 2 inches above. Okay, Sky, I want you to tuck your chin in. We're going to be bringing her OML perpendicular to the board. And let's see, drop my you to line it up here. Elevate it a little bit on the sides. Okay. I think, there we go. So it's coming in at the level of her her EAM here, and it's about 2 inches above. I'm just going to center her a little bit better right about there. For this one, you want to have the top margin of your collimated field just above the highest point of the cranial vertex. So I could collimate this down a little bit more. Right about there. Okay? There we go. So for this one, I'm going to be using a technique of about 85 at 10 mass. So Sky, I want you to hold your breath, expose. Now for this one, I can take off my tube angle. We're going to be doing the submento vertical projection. It's also known as the Schuler method. There we go. All right, go ahead and scoot forward for me. For this one, you're going to be placing the vertex of the cranium right against the board in order to bring the IOML, the infraorbital medial line, perpendicular with the board. So go ahead and bend hyperextend your neck. There we go, and I'm going to have her go close to the board. There we go. And that line is parallel now. The IOML is parallel. I think I said perpendicular earlier. And we've got her mid-sagittal plane perpendicular. Where she is centered, I'm going to bring this down to about 3/4 of an inch above her external acoustic meatiness, and it's centered in between the angles of the mandible. And so now I'm going to bring my board down. Watch out, Sky. Here we go. And I'm going to collimate in this way. Just going to kind of rotate it back. There we go. So for this one, I'd be using a technique of 85 at 14 mass. All right, so Sky, go ahead and hold your breath. Expose. And that would be my last projection. You can go ahead and relax. Thank you, Sky. I'm all done. Okay.
All right, so let's get started. I want to first evaluate my Caldwell method image, the PA projection. So looking here at this image right away, you can tell that the entire cranium is straight on. There's no rotation or tilt. It was properly collimated, and you can tell that the petrous ridges are symmetric and that the mid-sagittal plane of the cranium is aligned with the long axis of my collimated field. The purpose of this projection is to demonstrate the petrous pyramids laying in the lower third of the orbits, and you can see that's what's going on. The entire cranial perimeter is showing 3 distinct tables of squamous bones, and or squamous bone, I should say, and you can tell that it's been properly penetrated. It's clear in the center of the picture that we can see that petrous ridge there, sort of in between the eyes. You can see it's kind of hard to see on this computer, but you can see the dorsum sella a little bit, the frontal bone, the parietal bone, the crista galli is fairly visible. You can see the ethmoid sinuses very well. Yeah, so that would be the PA axial skull, or the Caldwell method. Moving on to my lateral projection of the cranium, you can see that this image is also properly collimated. There's no rotation or tilt, which is demonstrated by the superimposed orbital roofs and the greater wings of the sphenoid. The superimposed mastoid regions are not clearly seen in my image. There is anatomy cut off at the lower portion of the mandible, but it is clear that the external acoustic meatus on either side is superimposed. The TMGs are also superimposed. You can see the sella turcica in profile very well, and that there was adequate penetration of the parietal region. And also important, you can tell that there is no overlap of the cervical spine over the mandible. So that is all very well and good. You can see the supraorbital margin there very well, and it looks to be all in line. And we already mentioned the sella turcica. The petrous portion of the temporal bone is also seen there as well, near the external acoustic meatus. So this lateral image of the cranium is looking beautiful. This image that you see now is the image that I took using the Town method. It is the AP axial projection of the cranium. It is clear that the cranium is demonstrated in its entirety, without rotation or tilt. You can tell this by looking at the lateral borders of the skull. They are equal to the lateral margins of the foramen magnum on either side. The foramen magnum is nicely centered. There are symmetric petrous pyramids, and you can also see that the mid-sagittal plane of the cranium is aligned with the long axis of my collimated field. You can also see within the foramen magnum the dorsum sellae and the posterior clinoid process. And of course, it's also clear that the occipital bone has been appropriately penetrated by looking at the brightness and lateral border of the skull. So that's my Townes projection. You can see, just to point out a few things, the petrous ridge there is sort of in the center near the foramen magnum, and the dorsum sellae in the center again of the foramen magnum. I'm not sure if I mentioned that. So that's it. That's my Townes method. And my final image of this skull series is the submento-vertical projection of the cranial base, also known as the Scholler method. You can tell that there's no tilt, so then you can see that the entire cranium is included. You can see that it is level and centered by looking at the lateral borders of the skull to the mandibular condyles on both sides. There are symmetric petrosi, the plural word for petrous. The infraoccipital meatal line is parallel to the IR. That's demonstrated by looking at the mental protuberance that's superimposed over the anterior frontal bone and the mandibular condyles, which are anterior to that delightful word, petrose. You can also see that the cranial base was penetrated correctly, the appropriate brightness and contrast. In this image, the maxillary sinus is obvious there on the right side of my patient near the top of my thumb. You can also see the ethmoidal air cells being demonstrated and the sphenoidal sinus sort of in the center between the mandibular angles there, just above the dens, which is being visualized through the foramen magnum. You can see the foramen spinosum. You can see the mastoid process and the occipital bone very well. So that is my last image for the skull series. Thank you for watching my trigger.